Channel Island. Family Dental Office. Premalignant lesions, Erythroplakia and Leukoplakia. Welcome to our YouTube channel. In today's video, we will talk about an important and relevant topic for oral health: premalignant lesions in the mouth. These lesions can be the first step in the development of oral cancer, so it's critical to understand what they are, how to identify them, and what steps to take for prevention. Join us as we explore this topic in detail. These are abnormal cell growths that, although initially harmless, have the potential to develop into cancer over time. There are two main types of premalignant lesions: Leukoplakia and Erythroplakia. Let's take a closer look at each of them. Leukoplakia. Leukoplakia presents as a white or gray spot or area in the mouth that cannot be scraped off. It usually occurs when the oral mucosa is irritated over a long period of time. Although most leukoplakias do not develop into cancer, approximately 20% of them may initiate cellular changes that progress to cancer if not properly treated. Erythroplakia. Erythroplakia is an abnormal area of red, flat tissue in the mouth. It usually occurs when the oral mucosa is abraded and may exhibit a velvety appearance with small white patches. Unlike Leukoplakia, Erythroplakia has a higher risk of developing into cancer, and approximately 91% of diagnosed cases are malignant or progress to cancer. Symptoms of premalignant lesions. In many cases, premalignant lesions have no visible symptoms. The person may notice a color change in the tissues during brushing or flossing. However, if the lesion is on the vocal cords, there may be voice changes that worsen over time. Risk factors. Aging is a risk factor, and people over the age of 40 are considered to be at increased risk of developing these lesions. Although the difference between the sexes is not very great, a predilection for men has been observed. Smoking or chewing tobacco significantly increases the risk. Excessive alcohol consumption is also associated with an increased risk. Treatment of premalignant lesions. The treatment of premalignant lesions depends upon their severity. In some cases, it is recommended to remove the irritating stimulus and wait for the lesion to resolve. However, if the lesion persists or is considered high risk, treatments such as laser surgery, cryosurgery, or even treatments used for cancer, such as radiotherapy, chemotherapy, and immunotherapy, may be performed.
That's all for today. We hope this video has been useful to better understand today's topic.